Okay, moving on to chapter 18 where we talk about drugs. So we will go over the learning objectives. This is a long slideshow. Hopefully I won't talk forever. Okay, so what is a drug? A drug is something that changes the function of a living thing. So if you look at something like sugar, sugar is not a drug, sugar is a nutrient. Ethyl alcohol is a drug. That changes the way our body works. So, but drugs are not necessarily, that's a recreational drug, of course, but drugs can do other things. They can be for heart medication, they can be to prevent or to treat cancer. So, not all drugs are bad. Okay. Okay. Drugs, we can get them from plant sources, microorganisms, or synthetic. And from the laboratory, Paul Ulrich determined that certain drugs were much more toxic to organisms than the human cells. So, and then he had the word chemotherapy. And so he was awarded the Nobel Prize in Physiology in 1908. So the Nobel Prize, that is the highest prize you can get. Nobel, okay, so I guess it can be story time. Why not? This will be a long lecture. Nobel and his family, they made lots of money making dynamite. So they had a dynamite factory and they sold bombs. And also, well, uh, Nobel was feeling very guilty about this, so as he was had all his money later in his life and thinking about all his money that he made from all his bombs, and he hired some people. He was in Sweden. He hired a group of smart Swedish people, a think tank, and said, you know what? I'm being called the doctor of death. How do I improve my image? And then the think tank said, hey, what you need to do is you need to get a large pot of money together and then set up a foundation that will award a prize to someone who's done really, really good for the world. And in establishing this foundation, you will clear your conscience and be and have good karma or something. I don't know, whatever. They'll and that's what he did. He did that, and that's where he started the Nobel Peace Prize. So the Nobel Peace Prize, it's also the only one that is not awarded in Sweden. The Nobel Peace Prize is awarded out of Norway. So Norway were like the neutral hippies back in the day. Well, I guess if you know any, that maybe many people are still that way. It's kind of like the hippie Berkeley kind of area of Europe. And but Nobel later on went and established literature, economics, physics, chemistry, and physiology. So you can get Nobel prizes in any of those, and then the Nobel Peace Prize. So the Nobel Prize, this is considered to be the highest honor, and it's given out in October of every year. Okay, so let's start off with non-steroidal anti-inflammatory drugs. So that's what they mean. NSAIDs are non-steroidal anti-inflammatory drugs. And here's various ones. Here's ibuprofen, naproxen. Aspirin is another one. That's acetylsalicylic acid. Acetaminophen. Actually, acetaminophen is not an anti-inflammatory, so that shouldn't be on this list. I don't know whether put on the list there. It's a different type of thing. We'll learn about this later. Um, so aspirin is also a blood thinner, and it blocks proglastins, prostaglandins. So and these can cause blood clotting. So many people, I actually do take a small dose of aspirin before I go on an airplane, for instance. Uh, just it's one way you can help prevent blood clots from forming. Okay, but my heart is fine, don't worry. And my heart is in the right place as well. Okay, so NSAIDs, so non-steroidal anti-inflammatory drugs, are also called antipyrolic. So anti-fire, they're fever reducers. So they block these, and so they can reduce the fever. And also how they work So aspirin, ibuprofen, naproxen, they all block both the COX-1 and the COX-2 enzymes. So let's start with COX-2. Let's say you sprain your ankle, and you sprain your ankle, and your body sends the COX-2 signal saying, "Hey, I'm injured," and your body responds by making it swell. So this I guess I think of the Jedi mind trick. The ibuprofen, the other NSAIDs, they say it's kind of like saying the Jedi mind trick. There is no injury. There is no need to swell. It blocks that signal, and therefore it can reduce the inflammation and thus the pain from the injury. But aspirin, ibuprofen, naproxen can also blocks the COX-1 enzyme, which could lead to stomach. So it's your stomach and kidney function with that. So so this is Celebrex. So this is a COX-2 inhibitor only. It does not have the COX-1 enzyme blocked. So one thing about Celebrex, so I personally have a sulfa allergy. I can't take sulfa drugs, and Celebrex is similar in structure to sulfonamides. So this is one drug I cannot take. But I can take all the ibuprofen I want. Yay, adulthood. Acetaminophen. So this is different than the other. It shouldn't be considered an anti-inflammatory. It's not an anti-inflammatory, but it's the way that it works. It's a COX-3 inhibitor. What it does is it kind of artificially raises your pain tolerance. So, like, right, you can handle a certain amount of pain. Like, I wake up, you're like, I feel a little stiff. It's not too bad, but then you're gonna like, oh, this really hurts. So, what acetaminophen can do you can like, oh, this really hurts. Takes acetaminophen, like, oh, this is not too bad. It kind of works that way, but it's especially damaging to your liver because as your body is breaking it down. There's certain steps that are dangerous to your liver, and this can be exacerbated with alcohol for two reasons. Acetaminophen is more soluble in alcohol. It'd be really bad if you took it while you're drunk, okay? Because then the acetaminophen will go right into your blood, so it'll be absorbed really fast, and you'll have a spike of it, and then. The other thing is that it inhibits your liver is going to be working hard to break down the alcohol, and in the meantime, it's going to be damaged by the byproducts of the acetaminophen. So that's a bad idea to do that. Acetaminophen is found in other drugs too. So if you take Vicodin, Vicodin is hydrocodone and acetaminophen. Acetaminophen is found in many things, and so you have to be careful. This is one of the drugs you should be careful with. Okay, and many pain relievers combine things. So a lot of headache medicines can have have things like so it has this Excedrin here that has caffeine, aspirin, and acetaminophen, for instance. So there are various things. So cold and allergy medicine, there's tons of them available. This is to treat the symptoms and not necessarily cure it. So and look at them for effectiveness. Of course, some of them are hard to find now, especially pseudoephedrine because of its use to make crystal methamphetamine. Okay, so antihistamines. We talked a little bit about this before with stomach stuff. So antihistamines. So you can see there's histamine right there. And this is specifically it's H1. This is the H1 blocker. This is part of our immune system. So if we get something that our body doesn't like, that sees it as dangerous, it can release a histamine, and then your body will respond with like runny nose and various things like this, itchy throat, and that kind of thing. So uh, the antihistamines, what they do is they prevent that from happening. So they prevent the histamine response, and they are all depressants as well. When you take these things, uh, be careful if you suddenly start taking them before a test, because it does a lot of them work in your brain. And they slow your brain down a little bit. But if you really just need them, I mean, by all means, take them. But they do affect your central nervous system. So cough suppressants. So these tend to be. This is to lower the cough. Uh, uh, what is it? The indication. The when you feel like you're gonna cough, whatever that's called. Like you have that tickle in your throat and you want to cough. What the cough suppressants? They're narcotics, either codeine or dextromorphin. Codeine is available by prescription in the United States, but and uh, 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 dextromorphin is what you can find over the counter. And it's also, I didn't know this, the diphenylhydramine also is found to be effective by the FDA for this. Okay, that'll make you sleepy. Dextromorphin, that stuff, I hate having coughs. If I take that stuff, I feel so sluggish. I feel like a big giant lizard when I take dextromorphin. Okay, and expectorants, guafenicin is the common expectorant. This makes mucus more watery, and it makes it easier to cough up. Uh, there are other things that you can use as an expectorant, though. Spicy food can be an expectorant. So chicken soup can be an expectorant as well. These types of things. So tea. So don't necessarily discount the drugs, but you can do the stuff at home as well. Decongestants. They use for occasional use. These help dry out your passages, your breathing passages. So phenylephrine. Pseudoephedrine. This is my favorite one, but it's hard to find. Like I said, because of the methamphetamine. So Sudafed, and a lot of the daytime cold stuff have many of these decongestants. Oh, the decongestants, they're also stimulants. So be careful if you are easily stimulated and you take these stimulants. Okay, narcotics, and these tend to be for painkillers. We can use some narcotics. We talked about the cough suppressants, but these work in general because they're dopamine agonists. Means you increase the amount of dopamine in your blood, so in your system. Dopamine is a neurotransmitter. It's one of the happy chemicals. So dopamine, it does a couple things. So in general, though, if you have a large amount of dopamine, it makes you feel good. It's part of our reward system. So there are some happy chemicals. So serotonin, dopamine, oxytocin. These are some of they make us feel good to have these chemicals in our body. And later on, we'll talk about psychotropic drugs, and we'll talk about how some of these the drugs can cause increased levels of those. May not necessarily oxytocin, but serotonin and dopamine. Certain drugs increase that. So alcohol, for instance, is a mild dopamine agonist. Narcotics are very, very high dopamine agonists, so they work very well in that regards. And we talked about pain medicine. So let's say you break your leg and it really hurts. You can take some narcotics, and that raises your dopamine levels, and then you tend not to feel it as much. Dopamine. What dopamine also does is it stops the progression of nerve pulses. So, for instance, like, have you ever noticed that, like, when you get dressed, as you're putting on your clothes, you notice your clothes as they're going along. And also, if you're in like a hot shower and like it's really hot when you first step in, be like, oh, okay, I've gotten used to it. That getting used to something, that is because of dopamine. So your body gets used to it, and you're like, okay, well, I kind of realize I'm wearing clothes, but I don't have to have my mind consciously think that I'm wearing clothes all the time. Whereas when you're putting your clothes on, like, oh, I feel my trousers over my legs. I can feel that. In the first few steps, oh, I feel my trousers, and then, oh, now I no longer feel my trousers. Happy day. So what's responsible for that is dopamine. And also, more fun fact. Maybe you've noticed me talking. I have a mild case of attention deficit disorder. We'll talk about attention deficit disorder drugs later in this. Attention deficit disorder is a lack of dopamine in the temporal lobe of your brain. The temporal lobe deals with hearing and memory. So I get easily distracted, and I can change topics from my memory faster than any normal people can, which is part of the reason why I've always been drawn to science and math. I like the connections between things, so I can see all these connections between things, and I've always thought it was great. I love having ADD. It's a wonderful thing. It wasn't so good when I was younger reading books, though. Okay, so narcotics, they work by increasing the amount of dopamine, and they are painkillers. And common one, opium. So you can, and from opium you can get morphine. Morphine is an alkaloid. It's a alkaline organic molecule that has nitrogen, and we can take that, and we can also take codeine and also heroin. We don't use heroin anymore. Heroin used to be used for various things. We no longer use heroin. We do use codeine and morphine, though. So we can also do synthetic narcotics, and they are much stronger than morphine. Methadone, methadone just it is a narcotic. It's an opioid, but it'll get rid of the symptoms of it. It just kind of saturates your receptors for it. So okay, so here are some synthetic narcotics, and I remember having surgery. Man, this stuff really knocks you out. I don't know what I was given. I remember they injected me with something and gave me, and they could have done anything they wanted to me. I was so high. But here are the various different types of narcotics. I've taken hydrocodone before, and I've never taken oxycontin, so oxycodone. But fentanyl, that's one that's it's particularly dangerous because many people can overdose very easily on it. Overdose, the for opiates, among other things, it decreases your breathing reflex. So the breathing reflex decreasing, and then a patient can overdose when he or she stops breathing from this. Okay, so here's a structure of some of those synthetic narcotics there. Okay, and morphine agonists. Okay, so these are morphine-like activity, and they block. They inhibit the action of morphine by blocking receptors. So these are the other ones. So these are pain medicines. So pentazoquine and naxolone can be used to treat these things. And there are also natural opiates, so endorphins. So if you are working out, and this is, they do like these, the runner's high. It's one of the reasons why I like to work out. The endorphins, especially the beta endorphins, you get the runner's high from good old exercise. And okay, so let's move away from that. We're going to talk about antibacterial drugs. In around the start of the 20th century, the leading cause of death was infectious disease. So if you can see this, the top three are influenza and pneumonia, tuberculosis, and also basically gastroenteritis. This is diarrhea, enteritis, and ulceration of the intestines. So infectious disease was the leading cause of death. Now, if you look, it's heart disease and cancer. So that's the leading cause of death now. It's the slow deaths that get us, right? So, but the infectious disease can still kill people, but it's not as common. So why is that? Well, it's because of antibacterial drugs. And so the first one, antibacterial drug, was sulfonamide, and it was, I forget the chemist that a chemist discovered it and actually treated his daughter with it. She was sewing. She got stuck with a needle, and it got needle, and the wound got infected, and they wanted to amputate her arm, uh, but the chemist gave sulfa drugs to her instead, and she recovered. So he was like, well, let's risk this, because they didn't want he didn't want her daughter to have her arm amputated. But so the way this stuff works, it prevents the microorganisms from generating folic acid, and we can get folic acid in our diet, so it doesn't bother us as much. But then, so then this can kill those bacteria. And sulfa drugs, so these tend to get gram-negative bacteria. So one thing is a broad spectrum. So let's talk about the drugs, what they mean. So broad spectrum means it kills lots of things, and generally speaking, there are many bacteria kind of fall in one to two categories, and the drugs tend to work on those categories as well. The gram-positive bacteria, there's a gram stain test. If it stains, it's gram-positive. If it doesn't stain, it's gram-negative. Um, Gram-negative bacteria tends to be in the GI tract and urinary tract, and in the in that kind of, and yeah, in the urinary tract and kidneys and that kind of thing. Those infections are more common that way. The gram-positive tend to be more the staph infections and pneumonia and the upper respiratory type infections. Not the viruses, but those are gram-positive. This sulfa wouldn't treat gram-positive as well. The penicillins would do better. Okay, so penicillin is another one, and it originally started with mold, and they work by inhibiting the enzymes that bacteria use make their cell walls, specifically the cross-linking. So it's antibiotic because it's so if you notice, the sulfa are antibacterial, so penicillins are an antibiotic. Antibiotic is also antibacterial. Antibiotic work by inhibiting the growth of it. So this is, if you're wondering what the difference between antibiotic and antibacterial. So penicillin is a true antibiotic. It inhibits the growth of the bacteria, and this works best for the gram-positive ones. So amoxicillin, it's a very common one that they use. Cephalosporins. So these are a bit stronger than penicillins, and so Kerflex is one of them here. Work in a similar fashion. And tetracycline. So here are tetracyclines. These are very broad spectrum. They bind to the bacterial ribosomes, and they're called tetracyclines. If you look at them, there's 4 rings. That is where the tetracycline comes from. So I've taken these for skin infections. Fluoroquinones. So Cipro and Levaquin are examples of fluoroquinone. These are also very broad spectrum. They inhibit DNA replication. So by inhibiting the enzyme DNA gyrase. So Cipro is the leading one here. With all the antibacterial drugs, they have various side effects. One thing about the fluoroquinones, they can make your joints stiff. So if you do, especially your ligaments and tendons. So if you're very active, be careful. You might want to take it easy while you're taking Cipro or Levaquin, for instance. Also, all of them are going to destroy your microbiome. So this is an emerging field, the microbiome, and So we have a symbiotic relationship with bacteria, and we need our bacteria. Much of our body is actually bacteria, and if we have an infection, that's a pathogen. That's an infectious bacteria. We can kill it, with these drugs, but at the same time, we also kill some of our friendly bacteria, and that can lead to various effects. So do be mindful of that. Okay, so I'm going to move away from bacterias and go to viruses. So what a virus is it's a protein coat and a nucleic acid, either DNA or RNA. So if it's DNA, it's known as a virus. If it's an RNA, it's a retrovirus. Herpes and HIV, those are both retroviruses, and they're harder to get, harder to kill. It's harder to control them. And herpes, there's various types of herpes. Many people think of herpes as herpes simplex virus 2, that's genital herpes. There's also oral herpes, herpes simplex virus 1, HSV1, HSV2, but smallpox is also a herpes virus, as is chickenpox, brownpox, these kind of things. So they're all in the herpes virus family. Bacteriophages are interesting. That always, I think some of these are kind of cool. But bacteriophages, they are viruses that attack bacteria. And there was an older technology where you could treat bacterial infections with bacterial phages, because they're not going to harm humans, but they'll harm the bacteria that are affecting the humans. So interesting stuff. Okay, so I mentioned that, and the the way a virus works is it goes into a cell and it takes over the cell and then turns the cell into a virus factory, basically. And the retrovirus, for instance, will turn its RNA into DNA. So, and most viruses are not zootonic. So zootonic means that it doesn't cross animal species. So there are a few cases where viruses do, but it's fairly uncommon. So which is why you can't give your cold to a cat and vice versa. Although bacteria is zootonic, you can, if your cat has a certain has a bacterial infection, it can give it to you. So keep that in mind. But you can't give your cold to the cat. You can give your cat pneumonia because that tends to be bacterial. Okay, so we have some antiviral drugs, and they're fairly effective, but they don't provide cures. So we, with HIV, for instance, we look at different stages. So we can control the virus, and the idea, though, if you become HIV positive, you can take the drugs, and the idea is you can continue to treat and not get to the point where you have AIDS. So HIV is human immune deficiency virus. AIDS is acquired immune deficiency syndrome, and that's when your immune system breaks down. Various drugs do this. So nucleoside analogs. This is the first drug that they tried. It's azetithiamine was this. The nucleoside reverse transcriptase inhibitors. This is to prevent new viruses from being formed, and also protease inhibitors, so it doesn't infect new cells. So antibodies, we have our own natural thing. Antibodies work this way, or I should say similarly. So an antibody will similarly work this way for that's our body's own defense against viruses. Okay. So now let's move on and talk about cancer. Cancer is one of the leading causes of death in our country. Depends on the type of cancer. So people say, I'm going to cure cancer. Well, there's a bunch of different types of cancers, a bunch of different types of cure. So many have high survival rate, maybe many have low survival rate. So it just depends on which cancer you have. So pancreatic cancer, for instance, is one that has a low survivor rate. And melanoma, skin cancer, has a high survival rate. Of course, it depends on when you catch it. So if you catch skin cancer in its early stages, you're probably fine. Pancreatic cancer, we've lost some pretty good people to pancreatic cancer. It's not a whole lot you can try, but it's the outlook is usually grim. I guess I should talk about what cancer is. So, cancer is a tumor. There's two types of tumors: malignant and benign. So, a benign tumor means that it's a tumor that grows slowly or not at all, or even shrinks. That's a benign tumor. A malignant tumor is one that grows quickly, and these are caused by mutations. So, a mutation and is a cell a cell mass that grows. For malignant tumors, what they do, they cause a couple effects. First of all, they absorb much of the nutrients around in the body, and then they physically, mechanically provide stress on the surrounding tissues. So let's say you have a liver tumor, that as that tumor is pushing, it's going to apply pressure on the rest of the liver and can cause damage to the liver that way, and also going to ultimately cause it not to function. Malignant tumors can also spread. So, like if you have skin cancer, it could spread to your bones, for instance, and then you get bone cancer and various other things. So, this is a very dreaded disease, and we do have some types of anti-cancer drugs. So, and they can cause damage. So, one of them is anti-metabolites. So they slow down your metabolism. So this the problem is with these types of chemotherapy, it can cause certain illnesses. So we have cells that reproduce really quickly in our hair and in our stomach lining. The anti-metabolites affect those as well and can cause stomach issues and hair to fall out for people that take these. So, and it affects the cancer more than the other cells. Like I said, certain cells also are affected. And there's some more anti-metabolites. Alkylating agents. What alkylating agents do, they're mutagens. They cross-link, they alkylate DNA. And these are mutagens, and they can give you cancer. So mustard gas is an alkylating agent. It's very, very carcinogenic, and in small amounts they can treat cancer too. So it's interesting that this is a cause and a cure of cancer all in one. A more common one besides this one is a drug called cisplatin. Has platinum in it. It's pretty expensive. Okay, so other ones. So certain antibiotics like antiomycin and radiation, chemotherapy, surgery can be used to treat cancer. So not necessarily chemical, but radiation. We talked a little bit about that in nuclear chemistry. It depends on the type of cancer that you have too. So this depends. But cancer, it's a scary disease. Okay, let's move on and talk about hormones. So this is our endocrine system. The pituitary gland that's near our brains, and it's tends to run the rest of the endocrine system, but they do various things. So we have our sex organs, the ovaries and testes. Those release depends on your gender, if you're male or female, for what type of hormones they release and what amounts. Males tend to have more of the androgens, and females have more of the estrogen and progesterone types. Kidneys, we have the adrenal glands around our kidneys, and so on. So these are the chemical signals in our body. Take anatomy and physiology, you can learn all about them. And here are the various things. Oh, vasopressin. Vasopressin also is also a feel-good chemical. People with high levels of vasopressin tend to be very close to their partners. Same thing with oxytocin. Oxytocin is another bonding chemical. And okay, but all these here. So I'm not going to read the list. You can read it yourself. Similar here. What about the drugs, though? So, I mean, well, okay, I can be a little slow here. And the regulators. So, prostaglandins. Prostaglandins. These are lipids from a fatty acid. They're similar to hormones, but they differ from the hormones, and they can mediate hormone action. So if there's anything wrong with your endocrine system, you can treat it with drugs. For instance, like for thyroid, for instance, thyroid releases TSH, thyroid stimulating hormone. Um, Actually, no, I guess your pituitary gland releases that. Sorry, and your thyroid controls your idle, your metabolism. So you turn on a car, the car is idling. It's if for people that have a high metabolism, that idle is higher. For low metabolism, the idle is lower. So okay, but uh, certain conditions with your thyroid, hyperthyroidism it's too high, hypothyroidism is too low, that can be treated with drugs and these types of regulators. So a steroid has a steroid of skeleton. You can see here you have cholesterol. That is one of our steroids. So if you're eating cholesterol, you're eating steroids. But usually when we say steroids, colloquially we mean androgens like testosterone. Androgens are the masculine characteristics, and estrogens are feminine. And you can see here that's I mean it's the hormones are fairly close in structure. That's the testosterone and estrogen are pretty close to each other in their structure. Okay, so progestin is any steroid hormone that has the effect of progesterone. So this is the idea behind birth control. So birth control pills are like here that it tricks your body, the female body, into thinking that it's pregnant. So and the also emergency contraceptives. Uh, this can contain both estrogen and progesterone. This disrupts the hormone patterns that are needed for pregnancy. It's actually pretty hard to get pregnant. I mean, the to fertilize for the sperm and egg to fertilize each other, and then then the fertilized egg to uh, deposit on the wall of the uterus. These are all not easy steps to do. So because of that, it's well, it's not that hard to make it difficult. It's already difficult to get pregnant, so making it more difficult will decrease the chance of pregnancy even more. Okay, and so use prevent pregnancy after unprotected intercourse. Well, even with protected intercourse, pregnancy is can still happen. Another thing, so non-chemical intrauterine device. This also this is another method. It does not use drugs, for instance, to prevent pregnancy. Okay, other things, emergency. So RU46, the medical abortion pill. So it prevents the body from maintaining it. Okay. Now moving on. Ooh, geez. Slide 55 of 87. That's going to be a long talk. Okay, let's talk about heart drugs. So there are drugs that increase blood flow supply. They normalize the heart rhythm and lower blood pressure and prevent liquid plaque from forming. So normalizing heart rhythm, so arrhythmia is an abnormal heartbeat. So you can treat that through drugs. Fibrillation is too rapid. So, and you can use a defibrillator to stop that. So coronary heart disease, so arteriosclerosis, that is the blockage of the arteries in the heart, and it leads to angina pectoris, the chest pain and heart attack. So nitroglycerin, you can treat it with this, and it makes the blood vessels relax. I've never taken it, but it apparently gives you a headache like no other. So if you take nitrates and suddenly you get a really bad headache, that's normal. Digitalis is for heart failure, and this is a glycosides release carbohydrates and steroids on hydrolysis. So treat that specifically. Okay. Also, now moving on, psychotropic drugs, as promised, drugs of the mind. So we have stimulants, depressants, and hallucinogenic drugs. So stimulants increase the speed of mental processes. Depressants decrease the consciousness, and hallucinogens alter it. Okay, so let's talk a little bit about nerve cells to start off with. Some things to note, though, are the areas between the nerve cells, the synapses. That's what's important, mostly important for the drugs that we're going to talk about. So, and neurotransmitters, and then the gaps there. That's important for what we're going to talk about. So, common inhaled aesthetic agents. So this is aesthetics. This is to prevent pain. So we used to use ether. That was the first one, ether, and then chloroform around the time of the Civil War. Ether and chloroform were used on the battlefield, hospitals in the Civil War. But nitrous oxide still used, also known as laughing gas. When I got my wisdom teeth out, they gave me that stuff. Nitrous oxide with oxygen does make one feel good, and various. That's the only. I've never. Well, I've I have accidentally inhaled ether and chloroform, and it gives you a headache from from heck. I'll say heck on here, guys. So chloroform, it's not a very pleasant high. Ether tends to make my hands and feet numb. I just inhaling it, and I accidentally, if I mean, I honestly accidentally, I don't like them in the chemical lab. I don't like the way either of them smell too. They smell terrible. Okay. uh, Epinephrine. Okay, this is secreted by the adrenal glands. This can cause the fight or flight response. So, and if there's a large amount of it, it can be traced back to some forms of mental illness. So, the norepinephrine, this is a relative of epinephrine, and it can lead to a manic state. So, deficiency in this can cause depression. So, and also talk about serotonin. I mentioned this before. Serotonin is another neurotransmitter. It's a happy chemical. So and if you get less serotonin, you get depressed. So how do we do this? So the norepinephrine and agonists, those increase. Uh, these will stimulate, mimic, or enhance the effects of norepinephrine, and can use to treat depression, anxiety, and OCD disorders. And norepinephrine antagonists, these block the effects of it, and then this can be used to treat hypertension, angina, and cardiac arrhythmia. So okay, so it's really one thing about drugs and contemporary pharmaceuticals. We really don't know and understand this. I mean, you can. I mean, of course, I'm teaching, and I know. I mean, I know a little bit about it, but it's well, I'm a chemist. We we don't really understand how the body works, and some of this is guesswork, and we just kind of do our best with what we can, and we've empirically, experimentally figured out that if you take these drugs, they tend to do these things, and this is what we think is happening. I mean, come on, think about what I was talking about with the ankle sprain. You sprain your ankle and it releases this COX-2. Like we've never seen a COX-2. You know, come on. This is something we kind of assign names to, and we think this is what's going on, but we really don't know. And much of this is guesswork. So, and that's difficult, of course, when you have to treat things. Because to get the right cocktail of drugs for a mental illness or an endocrine system issue, it's really easy if everyone for like a simple thing like birth control pills. That's fairly standard. I mean, there are usually not too many complications with that. But trying to find the right cocktail of drugs to take for an endocrine system or for a mental illness, this can be very difficult. Okay, and anesthetics. So These are used to treat pain and also to knock people out in surgery. So here are local anesthetics. Local anesthetics are ones that you apply to the sites and to the area that you're going to work on. I mean, I'm most familiar with this because I've had dental surgery, and lidocaine. Lidocaine is typically used. Lidocaine with epinephrine uh, is common for what they put in with the dentist. They inject that with you and with the lidocaine and the epinephrine too. Epinephrine is to increase the blood flow in that area, and then the dentist can work on your teeth and it doesn't hurt. So a word of caution: if you are a habitual marijuana user, we believe this is a guess. We believe that some of the psychedelic effects of marijuana comes from tetrahydrocannabinol (THC) coating the nerve cells, and we believe the next slide. We believe that these local anesthetics work by dissolving the edges of the nerve cells. So, but we're not entirely sure on this. We think that's what's going on, but we're not entirely sure. So one word of caution: if you are a habitual marijuana user, let your dentist know. If you're using a local anesthetic, they tend not to work as well or not work at all. So be careful with that. Okay, so modern anesthetics. It just depends. It depends on what we might do. So um, and it's the anesthesiologist's job. It's a very high-paying job, but it's also a very difficult job. And there's various ways you can treat pain. So local anesthetics. So this is it's just if it's just a local one, and but we although it says here we're not entirely sure why it does this. So working on it. So here's a local anesthetic. Some pictures. Lidocaine is usually what's given. Okay, barbiturates. These are depressants. They tend to they're used for sleep agents. So these they can be mild sedative and sleep agents, but a caution with barbiturates is they are synergistic with alcohol. So they to give them together, they make it much more powerful. So be careful if you drink with medicines because it can cause some very big issues, especially barbiturates, and narcotics are another one. So anti-anxiety agents. So these so benzo benzodiazepine. Benzodiazepines are the uh, the the antidepressant drugs that we use. Again, this is a think. We think they work on the GABA receptors. So, and these are also highly addictive. So these are the anti-anxiety drugs. Antipsychotic agents. So Rauwolfia from the snakeroot plant was used to treat hypertension. Reserpine, an alkaloid isolated from that, was found to be a sedative as well as antihypertensive agents. So using these was used to replace electroshock therapy. Electroshock therapy worked only by the fact that it just caused brain damage. So this is much better than using electroshock therapy. So this is the history of some of that. And chlorpromazine, chloropromazine or Thorazine was introduced as a tranquilizer. So these act as dopamine agonists, so similar to dopamine, and it seems to be effective for schizophrenia. So of course, it's hard to treat some of these diseases, and if you do have one of these, it can take a while to figure out what levels to have for each. So SSRIs, the selective serotonin reuptake inhibitors, these are things like Zoloft and Prozac. These are used to treat depression. So they enhance the effect of serotonin by blocking its reabsorption. So this increases the amount of serotonin and tends to make people happier. The people that take these also report to have very even moods. So one thing about RIs is it seems to make your mood very even. The other thing is that it may inhibit your dopamine cycles. So that seems to be a long-term effect of SSRI patients that take that. Okay, and stimulants, so amphetamines. Amphetamines we use to treat depression and narcolepsy. Narcolepsy is falling asleep all the time. Uh, yeah, yeah, good old Freud. If you remember Freud, he would treat people by injecting them with cocaine. People come to him depressed, and he'd inject them with cocaine, like, hey, I'm happy again. Way to go. See you next week. Good old days when you would treat depression with cocaine. Okay, so I do have ADD, but I did not respond very well to these drugs, so I never took them. Well, I did take them once, but I was just like, it's not so good. So they can be ADD is attention deficit disorder, and I got by with training. So of course I have a pretty mild case, and as I've gotten older, it's gotten better. Like my dopamine sites have become more accustomed to the low levels in my brain, so it's not as bad as it was when I was younger. But I love having it. ADD is a wonderful thing. 5 stars. I recommend. So okay, but here are the various amphetamines. You can see you got methamphetamine there. Of course, that is a illegal substance, and amphetamine. They're all amines. Okay, and cocaine is a very powerful stimulant. They they do use this for eye surgery. So it does have a medical use. They can use it for eye surgery to numb the eye. But it gives really high levels of dopamine. It gives really high pleasure really quickly. So there is cocaine there. Other stimulant drugs. So caffeine. Caffeine is a mild stimulant. So about 200 milligrams is the effective dose, and you can see here where you see the caffeine and other drinks. Caffeine also stimulates. It stops the anti-diuretic hormone, and it can cause you to pee more, to cause more urination. So that's one thing about caffeine. Maybe you've noticed. That's a side effect. There's also, but it is a mild stimulant on the mind. Nicotine is a very common stimulant. It's made from tobacco. It's an alkaloid from tobacco, and you can smokers and this is also found in vaping devices. You can get the nicotine from that as well. The nicotine delivery. Other psychedelic drugs. So these are hallucinogens. Lysergic acid diethylamide, also known as LSD or acid, and this is synthesized by the lysergic acid. That's ergot. That's a fungus that grows on various things. Rye is common that it would grow on that, and then reacted to form diethylamide. So this is a psychedelic drug. Psilocybin. This is what's found in mushrooms, and similar effects to LSD. And mescaline is a psychedelic found in peyote. So these are all hallucinogenic compounds. Marijuana is considered to be a hallucinogen. It's hard to categorize marijuana. We kind of give its own category because the chemicals that are in marijuana, there's a lot of them. They're cannabinoids. They're from cannabis, and one of the major ones though is tetrahydrocannabinol. So THC. This one here. This is major component. We believe that it works by coating the blood, coating the I'm making signals in the air, the nerve cells. So we believe that's how it works. So one thing with drugs, if you use drugs for their intoxicating effects, this can cause problems for the abuser and society. People become less productive when they're abusing drugs. Drug misuse is using drugs for the wrong purpose. So giving someone an antibiotic for a cold is an example that does not have an effect on the that does not have an effect on the cold. But what that can do is that can lead to antibiotic resistant strains of bacteria. So and the reason is there's always bacteria. We're coated in bacteria. It's part of our microbiome, and our body is constantly under attack from foreign objects. And bacteria can evolve around the drugs as well. So that's one of the issues with that. So, but don't worry, don't sit there and get all upset now that you've figured out your body is coated with bacteria. That's actually a good thing. So it's part of our immune system even. So it's like, all right, analogy like, how do you prevent a terrorist from carrying a bomb on the bus into the city? So one of the ways you can prevent a terrorist from bringing a bomb on a bus into a city is make sure that the buses are jam-packed full of people. If there's no room on the bus, then the person can't get in the bus and then take a bomb into the city. How do you prevent your skin from getting an infection? Have it covered in bacteria. If your skin is covered in bacteria, there is no room for another pathogen to come in there and cause an illness. So that's actually, like I said, it's part of our immune system. It's a good thing. Okay, but moving on. Placebo effect. This is if you think something is going to happen. This is the mind over matter. The placebo effect, it's like, all right, you got a headache. Here, take this pill. It's like, did your headache go away? Like, yeah, my headache went away. And like, I just gave you sugar pills. Ha 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 ha. That's a placebo effect. And we're also using new uses for old drugs. So an example of that is, what is that drug called? The anti-sleep one, or the anti-sickness. Wait a second. Used to treat. You can use it to treat cancer. And also Hodgkin's disease. Let me see here. And thalidomide. Okay, that's what I'm thinking about. Thalidomide. There's drugs. There was a drug called thalidomide that was released in Europe as a anti morning sickness drug for women. And the way the thalidomide works is it prevents vascularization. It prevents blood vessels from forming. And the problem is, though, that when women were taking this stuff, it caused their babies to be born without arms and legs. So it was a very common thing. The thalidomide babies, you can look that up. Thalidomide is now used. It can be used to treat cancer as well. So it's interesting that thalidomide and other types of drugs like it can now be used to treat cancer. So that's an example of using old drugs for new purposes. Okay, and now we are done. So I'm going to end the show right now. Goodbye.